I'm Lynn Dudek. I am the Speech-Language Pathology Manager with Step by Step Academy here in Central Ohio. Welcome to the Grade 8 for SLPs and ASD. What we're going to talk about today and what you will learn is at least 6 areas of knowledge needed to provide intervention for an individual with an ASD, ASD being an autism spectrum disorder. We're going to talk about multiple tools for assessment. That's always an area that SLPs are concerned with, and what I want to do is be able to provide you with a lot of resources for both autism in general and then very specific language tests. And then we're going to talk about multiple resources for interventions, both web-based and in print. And throughout the course of the presentation, I'll have web addresses embedded in the presentation so that you can just refer to those when you go back and read this. Also, during the course of the presentation, please feel free to submit any questions. We don't want to leave them all till the end because we don't want to run out of time. We want to make sure that we get to those questions, and I'll address them as they come in. So a very quick overview. We're going to talk about the core deficits of autism. There are some hallmark characteristics of autism, and we need to make sure that we're all on the same page in terms of autism and what those core characteristics are. Then we're going to talk about the Grade 8 for autism, and I have to confess that my now 14-year-old but then 12-year-old came up with the title of this. So proud mama there talking about her daughter who came up with the title for the presentation. And then we're going to talk about a bunch of resources. So core deficits of autism. Hallmark, we're all speech pathologists. Communication, absolutely. And we're going to talk a little more in-depthly about that. Also, the social aspect of communication, or the social aspect of autism. One of the questions that I get asked a lot, especially when you have a child who may have an undiagnosed developmental disability and autism is one of the suspected diagnoses, is how do you know the difference? And I always refer speech pathologists to that social component, because a child who truly has an autism diagnosis or would qualify for an autism diagnosis is going to have that social component where they're either unaware of the social interaction or they're aware but don't know how to engage in the social interaction. Whereas other children with developmental disabilities, you're not going to see that social component affecting their development. And then we're going to talk about the behavioral component, and then there are most likely some other occurring or other factors that we need to think of. One being sensory, and the other one being co-occurring conditions. And we're going to talk about each one of these pretty in-depthly. So first of all, communication. And if you'll notice, we have the list side by side, both in what a neurotypical individual would experience and then an individual with autism. So in the individual who we would consider neurotypical, a child may have a large vocabulary, interacts with their environment, so goes to the playground, sees the swing, runs to the swing, gets on the swing, talks about the swing, then plans what they're going to do next, goes to the slide, knows how to negotiate up the slide, down, how to wait appropriately for their turn. They're interacting with their environment appropriately as opposed to maybe pacing around the outside of the playground, and we've all seen those kids. We know that they really want to play on the playground, but they don't know how to interact with that environment. Our kids who are neurotypical are engaged with others, so they may talk about something they see while they're waiting in line to go down the slide. You'll hear reciprocal conversation. I say something, they say something. And then based on what was said to them, they continue the conversation, they either maintain the topic or they find a way to switch the topic, but in an appropriate fashion.